Today, I'm here to share my experience and learning in TCM OBGYN on the area of historical development. I firmly believe to be a good practitioner of integrated women's health care field, we must really understand some of the fundamentals of TCM. And part of it is to really look at a history, look at how it's developed, look at some of the important classics that support our work today. And as you know, TCM OBGYN has been around for quite a while. It has a rich history that spans around 2,000 years. And much of a focus has been on pregnancy, trying to help someone pregnant, a couple pregnant, conception, and postpartum care. And a wealth of experience and information has passed down to us via some of these classics that we will be looking at. The essential beginning really started in around 216 AD. Dr. Zhang Zongjin basically written the book of Xiang Han Run and also the Jing Gui Yao Lue, the essential prescriptions of the Golden Cabinet. In that book, there are 3 chapters, chapter 20, 21, 22, on the pulse, patterns, and treatments of diseases in pregnancy, postpartum disease, and miscellaneous gynecological diseases. This is such a seminal work, even today. A lot of formulas that existed on that book is still widely used. And to this point, to now, we have a great book called the TCM Science of OBGYN, or 中医护场科学. The first edition was published in 2001, and the second edition was published in 2011 by the People's Medical Publishing House in China. The editors are reputable, famous physicians in their own right, Dr. Liu Minglu and Dr. Tang Wanxin. And it was helped and written by over 73 well-known TCM OBGYN doctors. This is the most comprehensive text today and the most widely used for TCM and integrative OBGYN field. When we study, we need to have an approach on how to study TCM OBGYN because there's just so much information. One of them is to actually study the background, the history, the classics, the people that's involved in bringing this field to fruition. By understanding that, that gives us a framework. So since most information in clinical medicine has been preserved and documented in the classical books, therefore our approach is to gain understanding and try to appreciate these classics through a time, shall we say, a chronological process. There are countless of books, or what we call classic, but the truth is, not all books create impact. So what I'm going to do today is look at some of these classics that has created impact, and we can look at some of the things that they have contributed to this field. So we will focus on the ones that have the greatest impact on the development of TCM OBGYN. The very first book, San Sui Jing, is a book of what we call the Book of Mountains and Seas. We don't know who wrote it. It's multiple unknown authors, and existed around approximately 476 to 221 BC during the Warring State era. It contains descriptions of geological features, locations, medicine, and animals. You can almost say that this is like a farmer's almanac. It encompasses everything. And this is the earliest text that actually documents and describes medicines that have been used to treat infertility. I would say this is probably one of the earliest documentation of any kind of healthcare or any kind of treatment of women's health. And the next book would be Huangdi Neijing. Huangdi Neijing, as you know, has 2 parts of it. Su Wen is a theoretical foundation. Ling Su is mostly focused on acupuncture. So we are looking at the Su Wen mostly. In this simple questions, we call Yellow Emperor's Classic of Internal Medicine, in the simple questions section, we don't really know who wrote these 2 sections. We do know it's probably not Huangdi. we do know is probably numerous unknown authors compiling, putting things together, and this book probably is written around 99 to 26 BC, again in the Warring State era to the Han Dynasty era. And it was written in a way that it's about discussions between Huang Di and his ministers, such as Qi Bo, such as Lei Gong, such as Bo Gao and Yu Fu, and as well as Shao Si and Gui Yuqu, and are mostly health issues and questions. So many have referenced to OBGYN, and really this book is considered to be the first fundamentals of OBGYN in TCM. So if we look at Su Wen has given a lot of different contributions. The first is on anatomy. It's the first to mention the female womb, or 女子宫,女子包, basically is uterus. It talks about 包脉, which is the womb meridian. It's meridian and vessels that runs into the uterus. And talk about 包肉, which is the womb collateral. 女子包, it's like a 脏户, both 脏户, and it acts like a 脏 when it can transform gene, qi, and blood to nourish the fetus and creates menstrual flow. And it also acts like a fu at the same time because it can store and discharge essence, qi, and blood. So therefore, this is kind of like the first organ that we consider this as an extraordinary fu organ, or we call the qi hen zi hu. And then continue onwards, Su Wen talk about 包脉. 包脉 belongs to the heart and connects to the 包, connects to the uterus, connects to the house that houses the fetus. And 包络 belongs to the kidney and connects to the uterus. So 包脉 and 包络 is a connection between heart to the uterus and a kidney to the uterus. So that's the contribution of Su Wen on anatomy. And if we look at Su Wen on physiology, it describes the 7x7 order and 8x8 reproductive physiology for both women and men. And it's first described the function and the importance of Tiankui, we call it heavenly water, Cong and Ren channel, as well as kidney qi, in the reproductive function in reproduction. It also describes the unique female physiology of menstruation, pregnancy, labor, and breastfeeding. In pathology-wise, Su Wen pointed out that women tend to have excessive qi, but always somewhat lacking of blood. So this paved the foundation for a lot of blood-nourishing methods of treatment. It also described pathology underlying abnormal uterine bleeding, amenorrhea, abnormal vaginal discharge conditions, infertility, 增加, which is pelvic mass conditions, things like today, like ovarian cyst issues, dermoid cyst issues, or uterine fibroid issues, and adenomyosis issues. Dysphonia during pregnancy, and other conditions. He also talked about that excessive sadness depletes 包络, and yang qi moves internally upward to disturb the heart. So the regulation of blood is impaired, causing abnormal uterine bleeding. So it talks about how emotions, it talks about for the first time how emotional factor can be a disease causative factor. And in diagnosis, Su Wen pointed out that observation of color changes and other changes, especially below the nose, can be an indication of female reproductive organ issues, especially the lips area as well as the philtrum area. It also described that the more obvious movement of the hand Shao-yin channel pulse can be an indication of pregnancy. That's basically your heart pulse. It also described that weakness of both kidney ci pulse can be an indication of amenorrhea. So if the ci pulse, ci position pulse weakens dramatically, and you might see in amenorrhea condition and situation. In herbal therapy, Su Wen is not a book that has a lot of herbal formulas. In fact, we know it's listed approximately only 13 formulas. It's more of a theoretical foundation book. But interesting enough, there is one of a formula called the Si Wu Zei Gu Lu Ru Wan, which is a combination of Indo-conscious sapia, I think it's the soft bone of the kettlefish, and Rubia cordifolia in a dosage of 4:1 ratio. And this formula appeared in one of the 13 formulas in the Huangdi Neijing, and is used in irregular menstruation, depletion of menstruation. So at least we know that already in Huangdi Neijing, there is already a starting of this herbology and herbal therapy process. Now, let's continue to the historical annals, Si Ji. Si Ji is a very useful book, especially for scholars of Chinese culture and history, as a wonderful way to take a peek of what's going on in the Qin and Han Dynasty. And this book is written by Sima Qian. The exact time is unknown when this book was written, but we do know this is all about the Han Dynasty situation. In fact, it's a description of history from Huangdi era to the Han Dynasty. So it spans about 440 years, from 221 BC to about 220 AD. It described the first specialty of an OBGYN, which is Bian Que. I think we have heard Bian Que was a very famous acupuncturist. And one thing that you may not be aware of, he's also a very famous OBGYN. It also, in this book, documented 2 clinical cases of amenorrhea and lactation deficiency. Han Su is a book of Han, is basically a historical book that covers the first part of a Han Dynasty. Han Dynasty has really 2 parts of it. There is what we call the former Han, or the early Han, and then the later Han. Okay, so this Han book, the Book of Han, really covers the early part of it, from 206 BC to 23 AD. In this book, it described the installation of female OBGYN specialty doctors in the imperial court. Okay, and the famous ones are Yi Xu and Cun Yuyan. These 2 famous women. In fact, you could say that in documentation-wise, these OBGYN are female, and they are the first documented female OBGYN, TCM OBGYN physician in the Chinese history. And the use of herbs, this book also described the use of herbs to actually cause abortion. And also looking at and documentation of abnormal fetus also is there. So a wonderful book to kind of show what that early Han Dynasty is all about. And later on, the Book of the Later Han, also known as the History of the Later Han, is a Chinese court document that really covered the history of the Han Dynasty from 6 to 189 AD. And it documents the very famous physician of Hua Tuo. As you probably have heard of, since I was a little kid, I always enjoy reading his history about how he's a wonderful surgeon and was able to remove a poisonous arrow out of this very strong, very passionate, red-faced general called Guan Gong. And while Guan Gong is sitting there playing chess and drinking wine, and he doesn't really feel like there's any pain. And of course, we know now that Hua Tuo used Ma Fei San as an anesthesia, topical anesthesia. And as you know, Ma Fei San, it's a wonderful formula for anesthesia at that time. And also Shen Gao, he has created ointments that help to heal, help the old skin to get rid of, and help the new skin to grow. In the performance of abdominal surgery, you know, the Book of Later Han actually talk about surgery. So you can see Chinese medicine is not averse to surgery. It was just not as fully developed. And also because of the social taboo of not opening one's body. Therefore, that's why I think the surgery could have been developed more fully, but it wasn't developed as as well compared to conventional medicine today. And also remove of dead fetus. I mean, think about this. This is very early time. This is 2,000 years ago. We're talking about surgery. So it's in this time, Chinese medicine is way in advancement compared to conventional medicine. The next book is called the Tai Chang Su. Wow, this book, we just actually discovered it, okay? This is called the Book of Pregnancy, Labor, and Postpartum. And it was discovered in the Meng Wan Dui excavation in Changsha area. And it discovered over 3,000 cultural relics. And one of the relics was this book. Okay, this book called Tai Chang Su was one of the 15 medical related books discovered that detailed in clarity of that 10 months of gestation, labor, and postpartum care in the Han Dynasty. So it was very telling that the understanding of embryology is already quite advanced during this time. It also described when is the best time to begin intercourse to conceive. It talked about that you can start 3 days after menstruation is completely clear. It also described that the 10 months of the embryology and the concepts of nourishing fetus, yang tai. It described the concept and the importance of taijiao, what we call fetal education. And today, a lot of Chinese families still believe very strongly that the baby, when the baby is born, is not 0 age. When baby is born, it's almost 1 year old. The baby is learning things already when the baby is in mommy's tummy. So we need to actually educate and teach our child already when the baby is in mommy's tummy. So we call that fetal education. For example, listening very nice music, being able to reduce emotional stress, no emotional outbursts, and reading some fine, intelligent books that can stimulate brain development, playing piano, those kind of things can stimulate the baby's developmental development already when the baby is in your tummy. So you don't have to wait until when the baby comes out of mommy's tummy. So, and then there is the nourishing fetus according to the gestational month. We call it 足月养胎. So for example, the first month is a formation of embryo. Second month is the formation what we call a gel. The third month is the formation of a fetus. The baby is growing. In the fourth month, we talk about formation of blood from the watery energy, from the kidney energy. In the fifth month, we talk about formation of qi from the fire energy, from the heart. And in the sixth month, we talk about formation of tendon and ligament from the metal energy of the body. And the seventh month, we talk about formation of the bones from the wood energy. Eighth month, we talk about formation of skin, fascia, and muscles from the earth element, earth energy of the body. And the ninth month, we talk about formation of hair from the stone energy, which is a collection of all the different 5 elemental energy of the body. In the 10th month, all the organs are formed, receiving energy from heaven and earth. And this is sometimes in Taoist study, we say this is a time when the spiritual process, when the spiritual energy is starting to come to the fetus and they are ready to be delivered. Okay. So the next book is Shen Nong Ben Cao Jing, the classics of herbal medicine. I think all of us have heard about this book as we study herbology. It was written in the Han Dynasty and it lists around 365 different herbs for therapy. And it classifies herbs into what we call premium quality, or we call higher grade, average quality, and then the lower quality. And so these are different grades of herb, as well as categorizing herbs to plants, to animals, to minerals, and just different classifications. So these are the beginning of different classification. It included many herbs that are widely used in OBGYN. And it also renamed 女子包 to 子宫 during that time with that book. It stated that the wind cold attack to 子宫 in a woman can cause infertility for 10 years. So basically what it's saying is that if there is infectious disease in a woman, it can actually cause infertility, which is quite true if the infection is severe. And 经归要列泛论 discussion of prescription of golden chess is obviously, as I say, as an essential beginning, written by Zhang Zongjin at 219 AD in the Han Dynasty, and later on was edited by Wan Suhe, Li Yi, and Sun Qi. So a lot of time what we are looking at today, some of the Xiangheng Run is actually an edited version of what these doctors have done. And some of them has actually put in their own commentaries and trying to figure out what's lost and putting on some of the words in there to make up for the loss of words. 3 volumes, herbal and food therapy for various diseases also in there. And there are 3 chapters on gynecology and over 30 formulas that's collected and described. And a lot of them still are being used today. For example, 桂枝茯苓丸, that's used for pelvic mass, for 增加, especially during pregnancy. 焦艾汤, it's for abdominal uterine bleeding with pelvic pains, including occurrences during pregnancy and after an abortion. Okay, 当归芍药散, it's for gestational pelvic pain. And 甘麦大枣汤 for 脏燥. This is like, easily almost 2,000 years ago. This formula is still widely used today. For example, 甘麦大枣汤 is used for 脏燥 condition. As you know, 脏燥 condition is depressive and anxiety disorders. And 温经汤 is also used for menopausal abdominal uterine bleeding. So you can see some of these formulas are still widely used today, or its variants are also widely used today. Now, in this book, it also introduced the practice and the concept of vaginal douche and suppositories. For example, 凡丝丸 for leukorrhea, vaginal infection, amenorrhea due to stagnancy in blood and with clots. 蛇传之散 is very good for parasitic infection. So things such as what we call in-cold type of leukorrhea and vaginal infections can be used. And 狼牙汤, it's, I'm sorry, 狼牙汤 is for the parasitic infection. 蛇传子 is actually for the itchiness, very severe itchiness for leukorrhea and vaginal infection due to in and cold type. 狼牙汤 is actually used for parasitic infection such as trichomonas. All right, so the next book is 脉经, post-classic. It's written by Wan Suhe in 280 AD in the Jin Dynasty. It's the first book that created a systemic understanding and framework for post-diagnosis. And it also collected and synthesized earlier work such as Neijing, such as Nanjing, such as Jingui in post-diagnosis and diagnostic differentiations. Now, it has a very good section on OBGYN post-description and differentiations appearing in chapter 9 of total 10 chapters in this book. It says that in Qi position, which is a kidney pose, when it is persistent, when pressed, it's considered as a pregnancy pose. This woman is pregnant. Or 3-level pose, floating, middle, and deep. When they are continuous, you press them down and you can link them up and feel them very strongly, that is a pregnancy pose. It also discusses about Li Jing Mai. This is when the pose speeds up much more than your normal pose. This also occurs during the time of labor. So as you look at pregnant women, as you feel the pulse, if it starts to speed up, you know that labor is pending. He also provided new technologies, new terminologies. 拘经, 拘经 means menstruation that comes every 3 months. There are patients where that's normal for them, but period only comes once every 3 months. We call this 拘经. 避年 is somebody who gets menstruation only once a year, but they can get pregnant. They are pretty healthy otherwise. So they're a unique situation where people are like that. And then you have someone who is, another terminology is 激经, is somebody who gets menstruation, especially at the very beginning of the early pregnancy. So let's say they're pregnant, but they're still getting some sort of menstruation. So they have some bleeding, there's some spotting. Scares the woman quite a bit, but that is normal. That is nothing that creates problem for the pregnancy. So we call that 激经. The next book is 诸病源候总论, what we call the General Treatise on the Symptomatology and Etiology of Disease. Cao Yuanfang, he's an imperial physician, around 610 AD. Now the time is moving down now, getting closer to us, but not close yet. In the Sui dynasty, he did a major work on etiopathology that lays an incredible foundation. It's the earliest systemized work on etiology, on symptoms, on signs of disease. He classified 67 diseases and 1,739 syndromes. And 283 syndromes out of that 1,739 syndromes covering OBGYN. So it provides a pretty strong foundation in etiopathology understanding. And for example, in this book it says irregular menstruation is caused by overstraining, because overstraining consumes qi and blood. With this consumption, this can cause the body to be weakened. And that weakness, weakened body can easily attract wind-cold invasion from the outside. Therefore, it causes blockage in the interior of bowel. That means it's in your uterus, in your inside of uterus, damaging the Cong and Ren channels, damaging the Han, Taiyang, and the Shaoyin channels. So already a pretty good start in its etiopathology description of irregular menstruation. Let's move on to the next classic, Qianjin Yaofang. Qianjin Yaofang is known as 1,000 golden ducat prescriptions. It's written by Sun Simiao in 652 AD in the Tang Dynasty. This book collected 5,300 herbal formulas, expanded on Zhanghu theories and other fundamentals. It's a seminal book of Dr. Sun Simiao, who is a very famous Taoist physician. It described various TCM treatments, such as acupuncture, food therapy, massage, Taoing, and others. In this book, there are 3 comprehensive volumes on OBGYN. and he also talked a lot about sanitation. For example, he talked about how a knife that's made from metal should never use to cut an umbilical cord. That's a very smart discovery of that there may be bacteria, and that bacteria may cause infection to both the infant as well as the mother. So it talked very clearly around that time of sanitation and prevention. So we move on to this area where now we are starting to have some formation of imperial medical system. As you know, the emperors want to live long. So what they do is they hire some of the best physicians from the country and they bring to Beijing or wherever the capital is at. So during the Tang Dynasty, which is about 618 to 900 AD, this dynasty established the first imperial medical department. And is the first formalized educational institution to teach, to train these smart doctors, physicians, to take care of the royal family as well as the privileged government officials. Due to this educational influences, there are now more published books on OBGYN during this period. Notable such books as 备急千金药方, 外台必要, and 金孝长榜. These are all very, very famous, reputable classics that let's take a look at. The first one is 备急千金药方. Again, is written by Sun Simiao. We just looked at it earlier. He authored in 652 AD, and frequently we just call it 千金方. 30 chapters, as I say, 3 chapters on OBGYN, and it collects about 540 herbal formula in the OBGYN section. Because the whole entire book, it collected about 5,300 plus herbal formulas. So out of that 540 herbal formulas in these 3 chapters that's used for the OBGYN. He pointed out for the first time that infertility can be caused by problems from both men and women. So it's not just women that has infertility. Men can also contribute to infertility situation. He wrote extensively on antepartum, intrapartum, and postpartum care. He expanded on treatments for difficult labors and both herbal and acupuncture therapies. Seminal book on a lot of very good foundation for OBGYN. The next book is 外台必要. It's about this thick. It's basically written by Wang Dao. It's called The Medical Secrets of an Official. It's a clinical therapy book that included 40 chapters and over 6,000 herbal formulations. So he collected a lot of herbal formulation, he compiled them and put it together in a very nice digestible book format for us. And there are 2 chapters on OBGYN and around 85 different type of condition and over 480 herbal formulas. Further contribute to different varieties of herbal treatments for gynecological OBGYN conditions. Now we come to 藏宝, 金孝藏宝, and a lot of time we just call it 藏宝, treasure of obstetrics. This is probably the very first specialty book on obstetric alone. Is written by Zhang Yin at 853 AD in the Tang Dynasty. There are 41 chapters, 374 formulas on pregnancy, labor, and postpartum issues. It's, again, first specialty book on TCM obstetrics, and it describes maternal care, labor and delivery care, and it also describes care for the first time, probably in the world, at that time, identification and care for preeclampsia and eclampsia situations. So moving forward, around the Song Dynasty, around 960 to 1279 AD, we call this contemporary era of Chinese culture, as well as Chinese literature, as well as Chinese medicine. This is a time where the earliest TCM medical school for the public is now established. The Imperial Medical College, staffed by a total of 300 physicians and faculty, have 9 departments, which include an OBGYN department, and have listed, there's some book that listed 10 obstetric physicians at that time that staff this quote-unquote medical college. This is the earliest of specialty education for OBGYN probably in the world. And stimulated further refinement and development of a TCM OBGYN during this time. So during this time, there are some wonderful book that has came about due to this exploration of the educational system. For example, 十场论, which is a discussion of 10 labors written by Yang Zijian in about 1098 AD. It's a book on discussion of different fetal positions that during labor process, including the footing breech, transverse breech, flank breech, umbilical cord wrapping, etc. So it also discussed the use of hand technique on correcting such breach during labor, as well as the intake of herbs to help out in the situation. So it's pretty quite advanced during that time with that such a wonderful description already been documented. The next book is 卫生家宝, 产科备药, which is written by Zhu Ruizang in 1184 AD. There's 8 chapters total, 7 chapters on labor delivery, so you can say that this is almost an obstetric specialty book. It discusses the importance of having clean environment for delivery, as well as proper infant care methods. So sanitation, part of the sanitation is also in this book. It discusses the 3 postpartum conditions of 冲心, 冲胃, and 冲肺. Basically, these are eclampsia seizure, HELP syndrome, and microangiopathic hemolytic anemia, as well as cardiomyopathy. These are some of the very acute and dangerous conditions and situations just right during the labor delivery time. And so this book has actually come out and actually described some of this condition. Then the next book is 女科百要, 百问. This is a book that is kind of like a question and answer. It's like a question and answer FAQ type of frequently asked question type of format. And this is written by Qi Zongpu in 1220 AD. And 50 questions on gynecology and 50 questions on obstetrics. And he provided a very nice, clear explanation of etiology and pathology in this book. And now at least we come to one of the Bible of TCM, 妇科, gynecology and obstetrics. It's called a Great Treatise of Useful Prescriptions for Women. Chen Ziming in 1237 AD in the Southern Song Dynasty written this wonderful book of 25 chapters, collected 1,118 formularies, and this is kind of like the first time it really have 48 cases. So it's kind of quite comprehensive. It's not just listing of what to do, but also listing actual cases that these formula has been effective with. So this is kind of like the first Bible, first comprehensive text on TCM OBGYN. It has profound influences on the development and later on the writings of OBGYN in subsequent dynasties. And this book is also been edited by Xueji later on, but Xueji is an imperial physician in the Ming Dynasty, which included many of his commentary as well as case studies. It emphasized that liver and spleen are the sources for menstruation, and all OBGYN disorders originates from 冲任 channels and Baogong. Again, it became a de facto textbook of OBGYN for many generations to come. Now we come to a time where now we are coming to a Chinese history time where there's a lot of barbarian invasion, shall we say Mongolian invasion. This is what we call a Junyuan dynasty, and this is also the time that it's very fluid. There was a lot of famine, there's a lot of disease, and there's a lot of conquering war and famine situations. So Chinese medicine actually flourished during this period of time. And there are these four major, what we call Junyuan, four major school of thoughts, Junyuan, four major physicians, Liu Wansu, Li Dongyuan, Zhu Danxi, and Zhang Zihe. So, for example, Liu Wansu is the father of fire pathology. Li Dongyuan is the father of Earth School. Zhu Danxi is, I coined this wonderful phrase, yang is often excessive, and yin is frequently deficient. And then we have Zhang Zihe, who is into sweating method, diaphoretic method, purging method, and emetic methods to attack pathogens. He believes that if you get rid of all the pathogens, you don't really have to treat anything else. The body will cure and heal on its own. So these are the four major, basically, schools of thought during that period of time. So I'll just spend a little bit of time on two of them. Liu Wansu, for example, he's around 1110 to 1200 AD. He contributed the fire heat pathology. He believed that fire heat is the main etiology of many conditions and diseases. So he recommends cooling and cold herbs to reduce heart fire and to benefit the kidney water. And later has been recognized as the father of Hejian doctrine, which is named for where he was born in Hubei province. His OBGYN contribution are several. One, for example, he says, when there is amenorrhea, first is to reduce heart fire. Once heart fire is reduced, the menstruation will occur. Second, he talks about vaginal discharge are the condition of a Ren channel, not Cong channel, but Ren channel. He talks about how Cong channel deal with the condition of menstruation, Ren channel deal with the condition of vaginal discharge. Later on, we actually corrected to talk about how vaginal discharge is actually all the channel is all responsible, but the Dai channel is probably a little bit more responsible than the other channels. The third is that when there is too much damp heat in the lower jiao, in the lower ren channel, they will have vaginal discharge. So he connected that damp heat is the cause of excessive leukorrhea. Number 4, he focused on kidneys with young women. He believed that if you're going to treat disease in gynecology, OBGYN, most of the time, young women are the ones who have more kidney issues. The middle-aged people tend to have more spleen. Middle-aged tends to have liver issues, and while the geriatric older women we should focus on the spleen. So that is also a way to take a look at how these 3 zang organs influences OBGYN. Zhang Congzhen, 1156 to 1228 AD, he is the father of the pathogen attacking doctrine. Sometimes I just call it detoxification doctrine. He says very clearly, when nourishing life, when you're no longer sick and you just recovery, you should use food, not medicine, to help to recover, to nourish life. But when you treat diseases, you need to attack with medicine. And he believed that you cannot tonify at all until pathogens are all eradicated. So he focused on the use of diaphoretics, emetics, and purgatives to rid of pathogen. He is therefore commonly known as the father or the initiator of the attacking doctrine. And he has done a lot of contribution to OBGYN. He commonly uses emetic, vomiting method, and purging method to bring on menstruation, mainly for excess type of patients. But he also believed that if you have deficiency type of patient, you must use nourishing foods and tonification food, such as lamb soup, such as beef soup, to nourish deficient patients and to try to help to nourish the depletion of blood. He also believed by getting rid of phlegm, the menstruation will reappear, establishing this phlegm congestion concept as one of the causes of amenorrhea, which helped to establish the phlegm dam type of pattern in etiology in today's understanding of PCOS patients. The next book is 政治准绳, what we call the Standards of Diagnosis and Treatment, written in 1602 Wan Kentang in the Ming Dynasty, 44 volumes, divided into 6 specialties, and OBGYN was one of the specialty. And this is one of the most comprehensive texts of the Ming Dynasty of that time. And the next book is 吕科佐要, what we call a summary of gynecology and obstetrics. Xue Ji, as I said earlier, was a very famous imperial physician. In 1548 AD, he written this book. He has a vast amount of clinical experience. And this specific book is a comprehensive book on OBGYN and reflects uniquely how Dr. Xue approaches women's health. A lot of case study, wonderful, wonderful book to study. The next book is Guang Si Ji Yao, is Summary of Fertility, written by Wan Quan in 1549 AD in the Ming Dynasty. 16 chapters. It described the treatment for infertility, pregnancy care, postpartum care, and pediatric care. And he made this very clear. If you want to have beautiful child, if you want to have children that is free of abnormal genetics, man, he started with man, should clear his heart and control sexual desire to nourish the essence so that he can better prepare himself for the sexual encounter that can help his woman pregnant to have a wonderful, healthy, smart child. So it's a very interesting and very advanced concept on infertility care. The next book is Ji Yin Gang Mu, or Compendiums of Therapy of Women's Diseases, written by Wu Zhiwang in 1620 AD Ming Dynasty. It's 5 chapters. It's a comprehensive text that collects all the works before Ming Dynasty in the area of OBGYN. So it's a seminal book again. The next book is written by a very famous person who actually established this Mingmen concept. One of the co-initiators, it's called Zhang Jinyue, or Zhang Jiebing. His book is called Jinyue Quanshu, Complete Works of Jinyue. That's one of his names. So Zhang Jiebing or Zhang Jinyue in 1624 AD, in Ming Dynasty, he had written this 64 chapters on TCM, and it is mostly his experience, and especially relating to the Mingmen doctrine. It contributed greatly to kidney tonification methods. If you look at a lot of the fire doctrine, or what we call the kidney tonification methodology, you have to study his work. His work is brilliant in this area. And the next book is Hu Qinzu Nuke, Dr. Hu Qinzu, 1607 to 1684 in the Qin Dynasty. This book probably is published about 1690 AD, so it's getting close now. Is what we should call this as modern now. Emphasize on treatment of spleen, liver, and kidney in OBGYN conditions. He believed these three zang organs are mainly the internal organ conflict and issues that create a lot of the OBGYN conditions. He created many very simple herbal formula that don't have a lot of ingredients. They're very simple, very short formulas, and is very easy to use, and it's quite effective in many conditions. The next book is Yi Zong Jin Jian. This is called the Golden Mirror of Medicine. Wu Qian, written by Wu Qian, 1742 AD, Qin Dynasty, 90 chapters. It's a summary collection of TCM. It was directed by the emperor, so you can say this is an imperial sanctioned work and written by an imperial physician. It's very easy to read, to understand, and with simplified volumes. In fact, a lot of the modern TCM physicians, before the schooling where you have to go to all the different classes, this is the book they start to learn with. In fact, when I was learning my OBGYN, I started to learn the section on the OBGYN from this book. The next book is Da Shen Pian. It's called a Treatise on Obstetrics. It's written by Ji Zai Ju, which we don't really know who he is. This is kind of like anonymous writer. It's a pen-named publication in 1715 AD in the Qin Dynasty. And he incorporated more scientific information approach to obstetrics. It is very clear and concise. It's a more modern favorite book to obstetric than some of the old ones. And Yi Ling Gai Chuo, now we're coming to the modern era now. Now we're talking about the 1800s, 1900s, and coming after 2000s. One of my favorite book for the modern era is Yi Ling Gai Chuo. It's called Correcting the Errors in the Forest of Medicine. In 1830, Dr. Wang Qinren, he written this book after he reviewed and examined cadaver. And he realizes that the TCM anatomy is way behind. And the reason is very much that there are taboos on opening bodies. So he was only able to see maybe the body of a prisoner that's being executed, or people that's feminine dying on the street side, where he can actually see what's going on in the internal organ. So he examined the cadaver. He was very clear that we need to change TCM. This at the time, conventional medicine is coming in. He believed it's very important for TCM physician, and he's a fundamentalist. That means that he's really into the true fundamentals of TCM. But he also say that you must learn anatomy well. Okay, even for TCM people, for TCM physicians. So he shared his deep insight. The second contribution is on stagnation of blood conditions and using activating blood and relieving stagnation herbal formula treated. So his famous series of 足浴汤, 血虎足浴汤, 生痛足浴汤, 少户足浴汤, all the 足浴汤, 4 or 5 of them, it's used for blood stagnation conditions throughout different parts of the body. For example, 少户足浴汤 and 血虎足浴汤 is probably 2 of the most commonly used 足浴汤 today, and continue to enjoy a tremendous amount of popularity. 血证论 is another book called Discussion on Blood Syndrome, and this is written by Tang Zhonghai. about 1885 AD now, Qin Dynasty. It's a unique publication that describes and discusses blood pathology and its relationship with qi. He says this: all blood that does not discharge is basically stagnant blood. So if you have retained blood in your uterus, that's a stagnancy in the blood. And to allow the new blood to come in, you have to get rid of it, okay? And that's how you can regulate blood. So he believed that blood flow is regulated by Cong, Ren, and Dai channels. Therefore, Cong, Ren, Dai channel, as you know, also regulated by liver. Therefore, tonifying blood is really to tonify the liver zang organ. The next book is Yu Xue, Zhong Zhong Can Xi Lu, is records of combined Chinese and Western medicine. Zhang Xichun, 1918 AD now, Qin Dynasty 30 chapter, combines both Chinese medicine and Western medicine perspective with formularies, herbs, theories, discussion, and cases. You can say this is really the first book that is on integrative medicine, integrating TCM and Western medicine. So it's the first major attempt to bridge the gap, to help to bring together the Chinese and Western medicine. His contribution is great. He created An Cong Tang and Gu Cong Tang for excessive menstrual flow and or abnormal uterine bleeding. He also come up with the Cong Tang as well as the Cong Wan for amenorrhea and Zhenjia conditions. And not the least, the most widely used formulation today, So Taiwan, is used for prevention as well as treatments for recurrent pregnancy loss and the prevention of miscarriages by tonifying kidney. So for example, that is so widely used today in a lot of the OBGYN conditions. Now, coming to 1986, 1984, Luo Yuankai, one of a very reputable physician in Guangzhou College, at that time it's called Guangzhou College of TCM in the southern part of China. He is a wonderful physician. He written kind of like what we call the third and the fourth edition of TCM gynecology for the colleges and university of TCM at that time, and we call it Zhongyu Hu Kexue. This is a major text at that time, and a lot of people of my age study that book as a foundation. And not the least, now, as the latest, most comprehensive book, it's quite thick and is well written, and it's called the TCM Science of OBGYN, as I say earlier in the first few slides. It's the first edition is published in 2001, and the second edition published in 2011 by People's Medical Publishing House. It's a big book. The editors are Dr. Liu Minglu and Dr. Tan Wanxin, and is written over by 73 well-known physicians. Most comprehensive, and a lot of my lectures will be really using that book as a reference material. It's well written and has a lot of very good information for people who love TCM, OBGYN, and love to learn that and really integrate it into the conventional medicine scene. So thank you very much for listening to me today, and have a wonderful day.